Hello, and welcome. I'm Dr. Robert Clark. For over 30 years, I've had the privilege of sitting with thousands of patients, just like you, holding a piece of paper that can feel like it holds their future in its numbers. I'm talking about a blood work report, and I've seen the look in their eyes, a mix of confusion, anxiety, and sometimes outright fear. Does this number mean I'm failing? Does that one mean I'm running out of time? The kidneys, in particular, are a source of great worry for many seniors, and for good reason. They are the silent, tireless workers of our body, and when they start to struggle, it can feel like a quiet betrayal. Here's a startling fact. An estimated 37 million American adults have chronic kidney disease, and what's truly concerning is that a staggering 9 out of 10 of them don't even know they have it. It's often a silent disease until it reaches its advanced stages. Your blood work holds the secrets to your kidney health, and today, my goal is to empower you. We're going to pull back the curtain on those confusing acronyms and numbers. We're going to make sure that the next time you sit down with your doctor, you're not just a passive recipient of information, but an active, knowledgeable partner in your own health care. You'll understand what these numbers are truly telling you, when to be concerned, when to celebrate a victory, and most importantly, what you can do about it. Over the next few minutes, we will break down the 3 most important numbers related to your kidney health: creatinine, the glomerular filtration rate, or GFR, and the blood urea nitrogen, or BUN. Think of them as the 3 key chapters in your kidney's story. We'll translate what they mean, explore the normal ranges for seniors, which can be different than for a 30-year-old, and discuss what it means when they read too high or too low. We'll also talk about the smartest, most effective questions you can ask your doctor to get the clearest picture of your health. This isn't about creating fear, it's about replacing fear with knowledge and a clear plan of action. Because the good news, the truly wonderful news, is that with the right information and proactive steps, you have a tremendous amount of power to protect these vital organs and live a long, healthy, and vibrant life. You're not alone in this journey, so let's get started. Let us begin with the first number you'd likely see on your report under the kidney section: creatinine. I like to call this your kidney's personal report card. It's a direct, honest grade on how well they are doing their most fundamental job: filtering waste from your blood. So, what exactly is it? Every time you move, whether you're walking to the mailbox, lifting a grandchild, or even just shifting in your chair, your muscles create energy. The natural byproduct of that energy creation is a waste product called creatinine. It's produced at a very steady rate, every single day. This creatinine is released into your bloodstream, and it's your kidney's job to act as a sophisticated filtration system, pulling it out of the blood and sending it out of your body through your urine. When your kidneys are healthy and working at full capacity, they remove creatinine from the blood very efficiently. As a result, the level of creatinine in your blood stays low and stable. But if the kidneys are damaged or their function starts to decline, they can't filter it out as effectively. The creatinine then starts to build up in your bloodstream, and that's when we see the number on your lab report begin to rise. For most seniors, a normal creatinine level falls somewhere between 0.6 and 1.2 milligrams per deciliter, or mg/dL. However, this is one of those areas where normal can be very personal. Let me tell you about 2 of my patients, Arthur and Eleanor. Arthur is 72 and a retired contractor who has spent his whole life being active and has a good amount of muscle mass. His normal creatinine is around 1.2 mg/dL. Eleanor is 78, very petite, and has naturally less muscle mass. Her normal creatinine is around 0.7 mg/dL. If Eleanor's creatinine suddenly jumped to 1.2, it would be a major red flag for me, even though that number is perfectly normal for Arthur. This is why trends are so much more important than a single number. A result above 1.5 mg/dL, especially if it's been climbing over time, is a clear signal that we need to investigate what's happening with the kidneys. But it's also crucial to know that not every high reading means disaster. There are false alarms. For instance, eating a very large high-protein meal, like a big steak, right before your blood test can cause a temporary, slight increase. Being dehydrated is another common culprit. If there's less water in your blood, the creatinine concentration will naturally appear higher. Certain medications, like some antibiotics or even high doses of ibuprofen, can also affect the reading. This is why context is everything. Have you been drinking enough water? Did you change your diet or start a new medication? These are the first questions a good doctor will ask before jumping to conclusions. So, when you see that creatinine number, think of it not as a final judgment, but as the opening line of a conversation about your kidney health. If creatinine is the daily report card, then your GFR, or glomerular filtration rate, is the overall performance score of your kidneys. It's the gold standard, the number that gives us the clearest picture of your kidney function over time. Unlike creatinine, which is a direct measurement of a waste product, the GFR is a calculation. Your doctor takes your creatinine level, your age, your sex, and sometimes your race and body size, and plugs them into a complex mathematical formula. The result it gives us is an estimate of what percentage of kidney function you have remaining. Think of it like this. If your car's engine is supposed to have 100 horsepower, the GFR tells you how much of that power it's actually producing. A GFR of 90 or above is considered optimal, like a brand new engine. For seniors, a GFR of 60 or more is generally considered very reassuring. It's completely normal for kidney function to decline slowly and gradually as we age, just like it is normal to have a bit less muscle strength at 70 than you did at 20. So, seeing a GFR of 75 at age 75 is not a cause for panic. It is often just a sign of normal aging. What we look for, again, is the trend. A stable GFR, even if it's not perfect, is a good sign. It tells us that whatever decline has occurred is not actively progressing. Where we become concerned is when the GFR drops below 60 and stays there for more than 3 months. This is the official definition of chronic kidney disease, or CKD. And CKD is broken down into stages based on the GFR number. Stage 1 is a GFR of 90 or higher, but with some other sign of kidney damage like protein in the urine. Stage 2 is a GFR between 60 and 89. Many seniors are in this stage and live their entire lives without any major problems. The real call to action starts at stage 3, which is a GFR between 30 and 59. This is where we need to be proactive about protecting the kidney function you have left. Below 30 is considered advanced kidney disease, and below 15 is kidney failure. Let me tell you about Margaret, a patient of mine for many years. When she was 68, her routine blood work showed her GFR had dropped to 55. She was officially diagnosed with stage 3 CKD. Naturally, she was terrified. She had visions of dialysis and a life of restriction. But we saw it not as a sentence, but as an opportunity. It was a warning shot from her body. We worked together to get her slightly elevated blood pressure under perfect control. We adjusted her diet to be more kidney-friendly, and we swapped out the daily NSAIDs she was taking for her arthritis for a safer alternative. Over the next 5 years, her GFR held steady, right around 52. She didn't decline further. She celebrated that number every year because a stable GFR, even one below 60, is a tremendous victory. It means the plan is working. The GFR gives you the power to see where you stand and to measure the success of your efforts to protect your health. Now, let's talk about the third key player in our kidney panel, BUN, which stands for blood urea nitrogen. If creatinine comes from muscle metabolism, BUN is the waste product that comes from the breakdown of protein in your diet. When you eat protein, whether it's chicken, beans, or a protein shake, your liver breaks it down and produces a waste substance called urea. This urea travels through your bloodstream to the kidneys, which, just like with creatinine, are supposed to filter it out and excrete it in your urine. So, a BUN test simply measures the amount of this nitrogen-containing waste in your blood. The normal range for BUN is typically between 7 and 20 milligrams per deciliter. On the surface, it seems straightforward. A high number must mean the kidneys aren't filtering well, and sometimes that's exactly what it means. A high BUN, especially when paired with a high creatinine level, is a strong indicator that the kidneys are struggling. It is like seeing both the check engine light and the oil pressure light come on at the same time in your car. It points more strongly to a central problem. However, BUN is a bit of a tricky character. Of the three numbers we're discussing, it is by far the most easily influenced by factors that have nothing to do with long-term kidney damage. It's the sensitive one of the group. The most common reason for a high BUN level, particularly in seniors, is simple dehydration. When you're dehydrated, your blood is more concentrated, and all the substances within it, including BUN, will appear elevated. I've seen a patient, as BUN, jump from 18 to 30 just from a mild stomach bug that left them dehydrated for a day. Once they were properly rehydrated, it went right back down to normal. Your diet also plays a huge role. If you have a big steak dinner or eat a lot of protein the day before your blood test, your BUN can temporarily spike. It doesn't mean your kidneys are failing, it just means they had a much bigger load of waste to process from that meal. Conversely, someone on a very low-protein diet might have a deceptively low BUN level. This is why doctors almost never make a judgment based on the BUN level alone. It's a piece of the puzzle, but it's not the whole picture. We look at it in context with the creatinine and the GFR. A high BUN with a normal creatinine and GFR usually just tells me to ask you, have you been drinking enough water lately? It's a clue that points us toward hydration or diet, not necessarily disease. So if you see an elevated BUN, don't panic. Take a breath and consider the context. It might just be a reminder to pour yourself a glass of water. Now that we've looked at each of these three numbers, creatinine, GFR, and BUN, individually, the most important skill is learning how to connect the dots. A doctor doesn't look at these numbers in isolation. We look at them as a story. The relationship between them tells us what's really going on. So, let's walk through a few common scenarios, what they mean, and whether it's a time to celebrate or a time for a serious conversation. First, the best-case scenario. You get your lab report back, and your creatinine, GFR, and BUN are all squarely within the normal range for your age. Your creatinine is stable, maybe around 1.0 dl. Your GFR is well above 60, perhaps 70 or 80. Your BUN is a healthy 15 dl. This is a moment to celebrate. It's a clear message from your body that your kidneys are functioning beautifully. It's a testament to your good habits, staying hydrated, managing your blood pressure, and eating a balanced diet. This result doesn't mean you can forget about your kidneys. It means that what you are doing is working. So keep it up. Continue your annual checkups and monitoring, but take a moment to feel reassured and proud of your health. Now, for a more common situation in seniors, your creatinine might be slightly elevated, say 1.3 mcrew/dwell, and your GFR is a bit lower, maybe 58. Your BUN is normal. This is not a cause for alarm, but it is a signal to pay closer attention. A GFR that is consistently just under 60 means you have mild or stage 3 chronic kidney disease. This is the scenario my patient Margaret was in. The immediate and most important step here is to become a trend watcher. You and your doctor should pull up your lab results from last year and the year before that, if you have them. Has your GFR been hovering around 58 for the last 3 years? If so, that's actually very reassuring. It suggests the condition is stable. However, if it was 70 last year and is 58 this year, that's a more rapid decline that warrants action. This is a yellow light situation. It's time to slow down, investigate potential causes like medications or blood pressure, and make proactive lifestyle changes. The red light scenario is when you see a sudden and significant jump. Let Ishi say your creatinine was 1.1 mcl last year, and it is 1.8 ml this year, with your GFR dropping from 65 to 45. This is a warning bell. This is your body telling you that something has changed and needs to be addressed immediately. This could be caused by a new medication, uncontrolled high blood pressure, a urinary tract obstruction, or severe dehydration. This is the moment to act swiftly. This is when you schedule a follow-up appointment with your doctor right away to ask those critical questions we'll discuss next. Seeing all three numbers out of whack, high creatinine, high BUN, and a low GFR, is a clear sign that the kidneys are under significant stress. But remember, even a red light is not a dead end. It's a signal to stop and get the help you need to find a new, safer route forward. Knowledge about your numbers is the first step, but turning that knowledge into a productive conversation with your doctor is where the real power lies. Being an active participant in your healthcare is the single most important thing you can do. When you get your lab results, don't just wait for your doctor to say, "Everything looks fine." Come prepared with thoughtful questions. This shows you're engaged and helps your doctor give you the most personalized advice possible. Let's go through some of the smartest questions you can ask and why they are so important. The first and most direct question is, based on my GFR, what stage of kidney function am I in? This is a crucial question because it cuts through any vague language. An answer like your kidneys are a little weak is not as useful as your GFR of 55 puts you in stage 3A of chronic kidney disease. Getting a specific stage gives you a clear framework. It allows you to understand the seriousness of the situation, research what it means, and track your progress more effectively. It turns an abstract concept into a concrete piece of information you can work with. The second question, which I've already emphasized, is absolutely vital. How do these results compare to my previous tests from last year and the year before? As we've discussed, the trend is often more important than a single snapshot in time. A doctor's office is a busy place, and sometimes a quick glance might miss a subtle but steady decline. By asking this question, you are prompting a deeper look at your history. Are the numbers stable? That's great news. Are they slowly drifting downward? That's information we can act on. This question makes you a co-detective in the story of your own health. Third, ask a question about your medications. Are any of my current medications, including over-the-counter drugs, potentially affecting my kidney numbers? This is profoundly important. Many seniors are on multiple medications for various conditions. Some drugs, especially non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can be hard on the kidneys, especially with long-term use. Other medications for blood pressure, diabetes, or even heartburn can also have an impact. This question opens a conversation about your entire medication regimen and whether there are more kidney-friendly alternatives available. Finally, you should always ask about the plan moving forward. These three questions are perfect. Based on these numbers, should I make any changes to my diet or my hydration habits? When do we need to retest these numbers to see how things are progressing? And at what point should I be referred to a kidney specialist, a nephrologist? These questions demonstrate that you are not just interested in the problem, you are focused on the solution. You are ready to take action. It shifts the dynamic from being a passive patient to being the CEO of your own health team, and that is the key to achieving the best possible outcomes. Understanding your numbers and asking the right questions are the foundation, but the walls and roof of your kidney health are built by the daily actions you take. The wonderful news is that the most powerful steps to protect your kidneys are often simple, consistent habits that benefit your entire body. This is your action plan, starting today. First and foremost is hydration. Think of water as the constant, gentle cleansing rinse for your kidneys. When you are well hydrated, your blood is thinner and flows more easily, making it effortless for your kidneys to filter out waste products like creatinine and BUN. When you're dehydrated, your blood becomes more like a sludge, and the kidneys have to work much harder to do their job. How much water is enough? The old 8 glasses a day rule is a good starting point, but the best guide is the color of your urine. You're looking for a pale yellow color. If it's dark yellow or amber, that's a clear sign from your body that you need to drink more. Sip water throughout the day rather than chugging a large amount at once. And yes, things like herbal tea and water-rich fruits and vegetables count towards your hydration. Second is your diet. You don't need to go on an extreme restrictive diet, but you should focus on being kidney-friendly. This means emphasizing whole, unprocessed foods. Think berries, leafy greens like spinach and kale, bell peppers, fish rich in omega-3 fatty acids like salmon, and healthy fats from olive oil and avocados. What's equally important is what you moderate. This includes sodium, which can raise your blood pressure and strain your kidneys. Be mindful of processed foods, canned soups, and frozen dinners, which are often loaded with hidden salt. You'll also want to moderate your protein intake. This doesn't mean you have to become a vegetarian, but you probably don't need a giant steak every night. A portion of protein the size of a deck of cards is a good visual guide for a meal. Third, as we just discussed, is to be incredibly smart about medications. Review everything you take with your doctor, paying special attention to NSAIDs like ibuprofen and naproxen. For occasional aches and pains, acetaminophen is generally considered safer for the kidneys, but you must adhere to the dosage instructions. Never assume that because something is sold over the counter, it's harmless. Finally, manage the fundamentals. The two biggest risk factors for kidney disease are high blood pressure and diabetes. If you have either of these conditions, managing them aggressively is the single most important gift you can give your kidneys. Monitor your blood pressure at home. Take your medications as prescribed every single day. Control your blood sugar through diet, exercise, and medication. And of course, if you smoke, stopping is one of the most powerful things you can do for your kidneys and your overall health. These aren't just suggestions, they are your lifeline to preserving kidney function for decades to come. We've covered a great deal of information today, and I want to take a moment to bring it all back to one central, empowering idea. You are in the driver's seat of your own health journey. That piece of paper with your lab results is not a final verdict, it is a roadmap. It shows you where you are and it gives you the information you need to choose your path forward. We've demystified the 3 key numbers on that map. We learned that creatinine is your kidney's daily report card, a direct measure of how well it's filtering waste from your muscles. We learned that the GFR is the overall performance score, the most accurate estimate of your total kidney function, and the number that tells us if you have chronic kidney disease and at what stage. And we learned that BUN is the sensitive indicator influenced by your diet and hydration that provides important context to the other 2 numbers. More importantly, you now know that the trend is always more important than a single number. You understand the importance of comparing this year's results to last year's, looking for stability as a sign of victory. You are now armed with the specific, intelligent questions to ask your doctor to transform your appointment from a lecture into a collaborative strategy session. You know what it means to be a partner in your care. And finally, you have a clear, practical action plan. Hydrate wisely, eat a kidney-friendly diet rich in whole foods, be cautious with medications, and aggressively manage your blood pressure and blood sugar. These are not drastic, impossible changes. They are small, consistent choices that you can make every single day, which accumulate over time to create a powerful shield of protection around these precious organs. I know that facing any health concern can be daunting, but please hear me when I say this. Knowledge conquers fear. Your kidneys are resilient. By catching any issues early and taking these proactive steps, you can significantly slow, or even halt, the progression of kidney decline. You can live a full, vibrant, and active life. You are not a passive victim of your numbers, you are the informed captain of your ship. Thank you for spending this time with me today. If you found this information helpful, please subscribe to the channel for more evidence-based health tips specifically for seniors. I encourage you to leave your questions about kidney health in the comments below. I read as many as I can, and it helps our community learn together. Please share this video with a friend or loved one who might benefit from this knowledge. You could be giving them the gift of empowerment. Be well and take good care.